Hi guys, I'm Sofia Peralta, admissions counselor here at the College of St. Mary.
And I'm Daniela Rojas, and I'm the Occupational Therapy Program Coordinator.
And today we're going to be talking about some frequently asked questions about our occupational therapy program here at the college. So I'm going to just start off, Daniela, how does the accelerated entry program work, and what makes this program so unique?
This is a very awesome question and one that I love to talk about because not a lot of people know that this is an option. So this program is unique because it allows students interested in occupational therapy to earn an undergraduate degree in areas like kinesiology and exercise science and psychology while meeting all the benchmarks to go into our 3-year OTD program, so our Doctorate of Occupational Therapy. There's another very unique feature to this program, and it's the fact that you have guidance from 2 academic advisors, so the person in charge of your academic area, again like kinesiology and psych, and also myself. So I will follow up with you on all the benchmarks, all the requirements that you have to meet before you start the OTD program.
Perfect. And then just another question that's frequently asked by students, what is the biggest difference between an occupational therapist and a physical therapist?
Yes, this is definitely one that we hear very often. And number one, the biggest difference between OT and PT is that occupational therapy focuses on improving a client's ability to perform daily tasks, and physical therapy focuses on improving a client's ability to perform human movement. So OT looks at our patients more holistically. They make sure that the person is fulfilled with the things that they're doing, that if what matters to you is getting up and out of your bed for a moment, then that's what you're going to get to do. So it's not so much focused on physical tasks, but more on like the person as a whole.
Okay, perfect. Very good.
So Sofia, now I have some questions for you.
Okay.
What are the admissions requirements to be part of this program?
Yeah, so good question. So it's really going to just depend on if you're a high school or a transfer student. So as a high school student, you will need a GPA between 3 and 4.0, a composite score of 23 on your ACT, 3 references that can just speak to you personally, your work ethic, that kind of thing. This can be teachers, professors, managers, that sort of thing. A resume, a letter of intent that includes service hours, volunteer hours, and then healthcare hours, which is going to be very important. And then after that, we will compile everything in your file, send it up to the admissions committee, and then they will invite you to one of their match dates. So the biggest difference between a transfer student and a high school student is that you will need that prerequisite GPA of 3.25. And Daniela will explain this a little bit more. As long as you have 12 credits or more, we will not look at your ACT, of course. Can you explain a little bit more about that prerequisite GPA?
Yeah, of course. So this is something that I want everybody to be very aware of, and if you need to take notes, please do it now. So the main prerequisites are anatomy and physiology 1 and 2 with a lab. You need to have taken abnormal psychology, developmental psychology, medical terminology, research methods, and statistics. So all of those courses should have a 3.25 GPA, okay?
Okay, perfect. Thank you so much.
So my next question, Sofia, is once I finish this program and I go into the OTD and I do all my things, where can I get a job?
Very good question. So a lot of, occupational therapists will go work in clinics, hospitals. You could even teach at a university if you'd like. Home health care is what we see a lot, but I know you have a little bit more to add to this.
Yes, absolutely. So one of the fun things about this time of the profession is that it's moving into a very unique phase, and they're starting to breach occupational therapy into areas that haven't been there before. So primary care, they're doing some things in schools that haven't been previously done. So we're super excited to see the growth of this profession, and we're excited to see where our students take it, especially with the research projects that they have to do within the program, and all of the experiences like the field work experiences that they can do, international field work opportunities, study abroad things that they can do. So yeah.
Awesome. The one last thing I'd like to touch is if you don't meet those prereqs right away. So I see a lot with high school students that they have a really high GPA and they're just right on that cusp of that ACT. And same with transfer students, they'll be really close to that GPA, but just maybe not quite there. So what you can do is you can come into CSM as a kinesiology exercise science major or psychology for that first semester or two. And then what you can do is you can apply internally as a College of St. Mary's student. And that way you can start working with Daniela, getting your file together, that sort of thing. Again, the last thing I'd like to do is just invite you to our All Access Occupational Therapy night, November 12th at 5:30. Daniela and I will be there to answer any questions you have.
Bring your transcripts.
Yeah, obviously talk more about the program, get to know the campus a little bit better. So thank you so much for tuning in.
Yeah, thank you guys, and we hope that you have a great day. Please don't forget to reach out to us through direct message. Sign up for All Access Night, and please reach out to us if you have any questions or any concerns.